The shoulder joint needs stability, but there are no firm bony anchors between the head of the humerus and the scapula. And so, therefore, the tendons of muscles become important. And here on the scapula, just to point out, there is a supraspinous fossa above the spine of the scapula, and infraspinous fossa below the spine of the scapula, both on the posterior side, and a subscapular fossa on the anterior side. In humans and other amniotes, it is the tendons of muscles which proceed from the scapula to the head of the humerus which help to provide some stability of the joint, in addition to helping to move the arm. Only the live-bearing mammals, the Therian mammals, possess a spine of the scapula, which divided the ancestral supracoracoideus muscle into two muscles, the supraspinatus and the infraspinatus. In humans and in other Therian mammals, three of the rotator cuff muscles can be seen from the posterior of the shoulder: the supraspinatus, the infraspinatus, and the teres minor, while one can be seen from the anterior surface, the subscapularis. The supraspinatus has its origin in the supraspinous fossa and inserts onto the greater tubercle of the humerus. It will abduct the arm and stabilize the shoulder. The infraspinatus has its origin in the infraspinous fossa. It inserts onto the greater tubercle of the humerus, and it will laterally rotate the arm and stabilize the shoulder. The teres minor, from the dorsal lateral border of the scapula, inserts onto the greater tubercle of the humerus and will also laterally rotate the arm and stabilize the shoulder. And the subscapularis, from the subscapular fossa on the anterior surface of the scapula, inserts onto the lesser tubercle of the humerus and will medially rotate the arm and stabilize the shoulder.